presents a community conversation on public health preparedness program hosted by Reverend Daniel H. Lindo. Open discussions and insights on heat warnings and other public health emergencies. Philadelphia Immunization Program, preparing your home for every season. Personal preparedness to stay healthy. Engaging faith-based and community organizations to consider planning for emergencies. This and more is going down and will be discussed live on Island Vybe, Philly Caribbean Station, www.islandvybe.net, every Monday, 7 p.m. to 8 p.m.
Good evening, everyone. We are joining you again tonight on our regular community health talk on how to keep our communities healthy, safer, and even better. And so my name is Pastor Daniel Lende, and I am joined tonight with Ms. Kebe from Rising Up for Change. We come your way through the partnership of Island Vybe, Philly Caribbean Station. We are happy that you're joining us wherever you are tonight. And it's a pleasure having you at your comfort in your car, or maybe in your living room, or in your dining room, even in your room, wherever you are joining us tonight. We welcome you to this community health talk. And I will allow Ms. Kebe to introduce herself before we move on to what we're going to discuss tonight, how to help our community to be safe, better.
Good evening, everyone. My name is Kebe. I'm the program officer with Rising Hope for Change. It's good to be here again this evening. You're welcome. If you usually join us at this time, we say you're welcome. If you're just joining us, we say you're welcome. It's our hope that we can have a very solid conversation tonight on things very important to our community, specifically health issues. So stay tuned as we go through tonight.
Thank you so much. And so tonight we will be coming your way with what are the topics we're discussing tonight?
So we're going to talk about COVID-19, and we're also going to talk a little bit about the Shigida virus.
Okay, that is something probably that sounds new in the ears of people. And so that's why we want you to tune. Don't leave. Tune so you know what this new virus they're talking about, Shakeda. And of course, this is on CDC providing information, Philadelphia Department of Public Health, Pennsylvania State Department of Public Health as well. So stay tuned as we discuss all of these important community health issues that affect us. But the best thing is information. Knowledge is power. And so when you get the knowledge, when you get the information, it takes you a long way. And that's why tonight we bring you new information tonight. You might have not heard about that virus. You might have not heard about it. And that's why tonight you should glue yourself to this talk show tonight to ensure that you don't miss any bit of it. All right, don't miss any bit of the conversation, particularly as we'll be talking about this Shakila virus. So don't trip your phone or your computer, whatever it is. Stay with us tonight. Okay, stay with us. Now, Ms. Kebe, talking about still vaccination, booster shots, and so forth in this spring that we are in. Why is getting vaccinated, right? Why is it that they're getting vaccinated and receiving booster shots becomes so important for COVID-19, prevention and so forth? Why do you think so?
It's very important because in as much as they've lifted the restrictions for COVID-19, that is like wearing masks at certain places, we all know COVID-19 is still here. It's just that it's not epidemic no more. So the precautions that we were taking before, people are not taking it now. They're trying to like normalize it. But COVID-19 is still around, it's still very around, and it's still very dangerous for most people. So what the vaccine does and the booster does is that it decreases your chance of getting severely ill when you catch the virus. So like when we just had COVID first, the beginning of the pandemic, how people were hospitalized in huge numbers. People died. So the virus the vaccine helps you so that you don't reach to that point where you become hospitalized or become very, very ill that you cannot do things for yourself. Or and the vaccine helps you so that you should not easily spread the COVID-19 to other people around you too. So what it's literally going to do is it's going to help to minimize the amount of COVID-19 cases that we will get. If you're vaccinated, I'm vaccinated, the chances of us catching it is low, and the chances of us spreading it to other people is also low.
You vaccinated and vaccinated, it mitigates or reduces the chances of you being infected or affected by the virus. Very important. So literally, vaccination and boosters, they become so crucial for us, right?
Yeah.
As they are very significantly, they significantly reduce the rate effect of infection or contraction, or particularly the severe illness component of it or hospitalization. When you are vaccinated, you have your boosters, it reduces the illness from hospitalization. It causes you not, it reduces the potential of what, when people were supposed to get to be hospitalized, it reduces, it cut down that eliminate that factor of hospitalization at a very significant extent. But most importantly, it also reduces the death rate. And then what happened? It helps to curb the spread of the virus further. So this is the reason why everyone must think twice, especially in the spring where people are cutting weeds, in their yards, cutting grass, you're trimming, flowers are blooming, and then all the allergies are coming up there and so forth, and things that maybe where people get out there and everyone get out there at once, and so things can happen, and so the virus is stay around is still common among us. And so even though like Ms. Kevin said, like the health specialists are saying no more marathon on the disease itself, but what happened now is that you don't forget about yourself. Don't forget and take chances to say, well, this thing is gone, and so no need for me to do so. It's always good because you love to continue to congregate, especially religious people. You want to continue to congregate. You want to continue to fellowship. You want to continue to group together. Get together is coming in this spring. As we looking forward to embracing the summer, many people will try to gather together at family get together. Memorial Day will soon be here where people will get together and so forth. So as you're planning all this, and 4th of July will soon be here, all of this, as you're planning to do this, it's important that you just take your boosters, take your shots, and just fortify yourself to make sure that you minimize the risk factor of you being infected or affected of this of the disease, though it is not as worse as it was yesterday compared to where we are today. But that is very important. So, Ms. Kevin, how can individuals stay updated in terms of being updated on the availability of the booster shots? How can they get updated on that?
You can visit the PDPH website. They have a lot of important information. You can talk to your physician. They can tell you just in case you want to know vaccines, updates, and all that. You can talk to them. They're gonna give you this information. You can go online. You can Google it. You're gonna have all this information pop up.
Particularly the facilities that are very close to you, right?
Right.
Could be pharmacy, your primary care provider, and so forth. So, individuals particularly, they should everyone regularly ensure that you check the local health department, right? Check the local health department in your community. Check what they are saying, what updates are available. Also, as you said, consult with the healthcare providers in your community. Many a time, people who of community fair, where all people bring their various institutions, health organizations, and so forth, community-based organization, they bring their tables, they line them up, and then everyone provides services to the community. When you
Mhm.
hear those things, they are for the community. Don't shy away from them. Don't run away. Don't think like it's for special people. These events are for the community. And in fact, sometimes even the township, the boroughs that you live in, sometimes they organize event and they call people to always show for. But sometimes people it's difficult for them to come to show for. So take advantage of this, follow the local news, right, in your community. And these are
Right.
all precautionary measures you can take because uh, for example, news that come on your TV or maybe papers, why you may be skeptical about 80% of what they say it's got some reality into it, and especially people are careful as to what they bring on air and so forth. So, but as Ms. Kevin said, it's important that you uh, also check with us, what CDC websites they update it regularly. And I know people still have some trust issue with all of this, regardless of what you say, but it's important that you understand that resources are available for you to make use of them. And that's why you should take advantage of the resources that are available to you. And don't take that for granted. Make use of those resources available to you. So, Ms. Kebe, are are there any kind of new variants of concern in terms of how do vaccines perform against them in terms of maybe like the Pfizer, the Medina, the J&J? Are there any concern in terms of their interaction, the way people, I know now the data might be low because it's not a talk of the town, right?
Mm-hmm.
But also it's important that we don't forget about it. And that's why we want to talk about it. That's why we are still not ashamed to tell you that go get your boosters. We are not
Right.
ashamed to tell you to say go get your vaccine. It concerns your health because whatever affect you, it could affect me. Whatever affect me could affect you. So we are proud to still talk to you that, still get
Mm-hmm.
your boosters. So what are some of the concerns in terms, if there are any though, in terms of those variants?
Right now, I think I can say CDC and all these other health institutes and with Pfizer and all of these vaccines people. I think they are on top of the game because I think that they are being proactive. If you know, they have been updated vaccines um from the previous one that we had during the COVID season. So they are now updated vaccines and they are encouraging people to get these vaccines because
Mm.
right now, I know that they don't want to catch want anything to catch them by surprise that the way the COVID-19 did. So they're studying COVID, they're still studying COVID, they're seeing new variants and they're creating new vaccines. As they're seeing new variants, they're creating these new vaccines. So every time they have an updated vaccine, they say, hey, we got an updated vaccine, you want to get vaccinated.
That's right. New variants particularly they may emerge, right? They may come
Right.
about as because if anything, if the vaccine has proven maybe stubborn to the current vaccinations that are available, or vaccines,
Mhm.
sorry, the virus, if the virus are proven stubborn to the current um vaccinations that are available, so what happened? They will continue to develop new ones, right? But
Right.
current vaccines have shown effectiveness. That's the good news. The
Mm-hmm.
current vaccines have shown effectiveness, and particularly in terms of reducing severe outcomes, even with the variants, right? They have shown effectiveness in those things. So that's why we encourage everyone to ensure that you yourself can stay updated with the boosters, which is very key and which is very paramount. So stay updated with the boosters, stay updated with your own vaccine card. So for your own good, it's important that you consult with your primary care healthcare physicians to kind of talk with them and see what their recommendations are for you. And of course, you can definitely take advantage of that. Yeah.
Right.
Now, what are some of the maybe recommendation or recommended intervals between some of these boosters that we're talking about in terms of the initial vaccination to the booster shots that are given? What are some of those recommendations? And probably maybe I can start by even stating that the interval may vary, of course, right? It may vary from this point to this point, especially with the type of individuals, right? Health
Mm-hmm.
status. So it depends, it varies based on your individual health status. You may be, especially when people have underlying conditions, right? People with underlying conditions, it different with those without underlying conditions. So it varies from one person to another. But did you have anything to add on that in terms of some of the recommended intervals between the initial vaccination and then relating that to the boosters? What are those things? As I mentioned about the type of individuals health status, right? Was there anything else that maybe come to mind?
Well, for people like you mentioned, people who have underlying health conditions who do not qualify to get the vaccination definitely will not get it. But if you qualify, but you need a special time frame to get the next shot, then your health practitioner going to tell you, hey, you just in case you have to give it a certain amount of time. Even doing it when the vaccine first came out for the COVID, those who got the first, there were two shots for, I think it was Pfizer. There was two shots, and after you get the first one, they tell you have to go home, and after some time, I think after a week or some weeks or some, then you can go back and get the next one. So that's how it is. But based on your health condition and the vaccines protocol, wherever you're getting the vaccination, or your health practitioner, they're going to let you know how long it's going to take to get the next one.
Mm, mm. That's right. And then also speaking generally in terms of the boosters, right? They are recommended because several after several months after the initial vaccination that people get. So what happens is that you do a follow-up with the specific guidance in terms of the type of booster you need to get based on what your physician will tell you, based on what your doctor will tell you. Let me just put it like that, based on what your doctor will tell you. All right. So yes, very important for you to know that. So moving forward, or fast forwarding, how can our community support vaccination efforts around us, especially knowing that we know some people who definitely didn't get it, and some we know that some will still not get it, but there are people that may say maybe because of other things, but some people think like saying there is no more, they are not forcing anyone to do it, or it's not a requirement from a lot of things, so they don't bother. But in which way our community can still support people who have not done so yet?
I can tell you for a fact, I know most of the people who got majority, a lot of people who got vaccinated when the vaccine came up for the COVID, got vaccinated because it became a requirement for some jobs and schools and all of that. So people were kind of forced. Now that is no longer the case. Those who did not get vaccinated are even more reluctant than how they were before. So, as a community, especially those of us who have all this information about the vaccines, know what it is, what impact, positive impact it brings to our community, I think it is upon us to be able to talk more about vaccination, especially if you know people who have not been vaccinated, or for whatever reason, probably because they have some myths, you want to like talk to them, give them resources, direct them to do their own research, and make it a normal thing, like normalize it, normalize talking about vaccination. A lot of people don't see vaccination as a necessity. They don't take it into consideration when they're talking about their health routines and all of that. But it is something that needs to be talked about more and needs to be given enough attention. So like we're having this talk show, we're talking about it. If you're listening and you know people, maybe through conversations, you can bring that up. Hey, did you get the vaccine? Do you know the vaccine is important? Through public gathering, you have the opportunity to speak. You can just show that in. and just do more awareness as possible.
Very good. And I think when it is not even talked about now, that's when people need, because nowadays you see, maybe you are in the office and you see, or maybe you go, you in a public gathering and you see somebody is almost having everything about the symptoms and so forth. I know we sometimes not careful the way we used to be, right? But
Mm-hmm.
and this is why we in fact need to now still encourage people to make sure that we can still encourage people to take their vaccines, because it's important, because people will keep mingling, they will keep crossing each other's path. And so that's why we should continue to do this. Um, so talking about the preventive measures that we need to take, what comes to your mind in terms of some of the essential preventive measures that we can take to avoid COVID infection at this time? What are some of those things you think? Oh, you muted, it looks so.
Oh, I'm sorry. I was saying at this time, I think the most effective is the vaccine, but also we should watch our gathering, look out for symptoms for infected people. And in as much as we're not wearing masks, if you feel comfortable enough to wear masks, go ahead. That's up to you. If you don't, that's not forced, like we all know. But you want to make sure that you pay attention to sanitizing, washing your hands, cleaning, because the germs and all of these things are leave on surfaces, so you want to wash your hands. You want to make sure you clean properly. When you in a gathering where you see there are sick people, you want to move away, because right now you don't know, since COVID has a lot of symptoms of that of the cold, and it's not severe to as it used to be. You might not know exactly what is going on with that person. It could be any other thing too. So you want to make sure when you're in public gatherings, you pay attention to your surroundings and be and watch out for people who look ill, especially showing signs of COVID-19.
Powerful. And I think key takeaway from there is, in terms of the daily thing that we need to be careful with, will be the daily hygiene, right? Washing of
Right.
hands, because it's through the hands you interact with so many things. You take things, you put things in your mouth, you take things out, you wipe your face, So it'll be important that you keep close to that to ensure that you wash hands all of the time, right?
Mm-hmm.
In addition to the many other measures that she mentioned about. Um, if probably you feel like you got flu, you got cold, it still won't hurt if you wear your mask, right? It won't hurt. First of all, it's going to prevent those loved one around you, okay, that you care about. And then also, it's going to help you to also recover a little bit pretty faster, because the virus is contained, and sooner it can even get faster, fastly treated. So proper hygiene will help us to really put us, it will serve as a preventive measure that we can take to help us to overcome this. And then of course, as we continue now to see the weather improving, our environment, people are preparing to get out. It's important to understand that even when we are in a crowd, we need to know how much distance we need to give into that, right? How much
Right.
we can put into that, because you don't want to just forget about yourself at the end of the day, it is your health, right? At the end of the day, it is you. When you get sick, it is you that go through it. It is you that everything gets stuck to. It is you that your activities will get stopped and they are not moving. Your plans are on the hurt. They are not moving because why? You are sick. So at the end of the day, you have to make sure that you take your own health into your own hand to make sure that you are doing things that will help you to definitely still healthy, things that you will do to help you to still keep your community even better safe. So moving forward on that, how effective are marks still? Can we still kind of, are they still recommended for us to use them? And if so, in which instances can we help our people to say, when you're doing this activity, try and use marks? when you're doing this sort of activity, try and use your face mask. What are some of those recommendations that you can give to our people?
Um, like I said earlier, if because there are some people who are extremely uncomfortable and sometimes might affect their breathing, like if they have some sort of health issues, they might not want to go that route. But if you feel that you're in a position where there are a lot of sick people or people, like I said earlier, people who are showing symptoms, probably at the hospital, you have to cater for people who are also showing symptoms of COVID-19. You want to take into consideration wearing your mask. If you're in a place where you cannot be out anytime soon and you see that you stand a chance of contacting COVID-19, probably from where you are, what you observe around you, or you cannot stop these people from leaving that place at the moment, you want to try to wear your mask. If you are going into a place where you are not sure, as sure of the people, the individuals that are going to be there, you're not sure of the crowd, you're not sure of what those people in the gathering going to have, you feel comfortable wearing your mask, you want to do that. So let's just say it's important, if you can, to have masks with you when moving around, depending on your occupation. Like I said, people who work in hospital, who work in healthcare facilities, you want to make sure that you have masks with you because these are places that usually have a lot of cases and outbreaks too.
Yeah, yeah. And also talking about practical, in addition to what you said, practical areas we want to talk about, can talk about also, like maybe people that maybe do exercise, in maybe through sweeping, right? You want to sweep
Mm-hmm.
your yard, you cutting grass, you organizing things, the dust over there. So it's important that you wear your mask so that you can save yourself from sneezing, dust, inhaling dust and getting into your system, and then just kind of irritating you, and then resulting into something. Just save yourself all of that. Grab a mask. It won't hurt. Again, it won't hurt for you to pull on the mask for the next few minutes that you are cleaning up over there. It won't hurt for you to pull on your mask when you are, when you are in an environment that is maybe polluted with some kind of stuff. So it won't hurt you doing that, right? It's
Mm-hmm.
just a matter of improving your own health. It's just a matter of you trying to improve your own health. So we recommend, just as health workers still recommend that you still use masks when it is necessary for areas that you feel uncomfortable, even for gatherings you feel uncomfortable. You can still get hold of your mask and use it, as Ms. Kara talked about that. So as we're talking about this, how can people assess the risks of COVID in different setting in terms of and when I'm talking about, I'm talking about the risks considering the factors such as the number of people, or maybe the type of people, indoor, for example, indoor versus outdoor, right? These are all the risks that get involved. Those settings, indoor settings, like some people, they will have birthday, now the spring is here, birthday parties will kind of boom up, right? Small get-togethers, right?
Mm-hmm.
And so in those smaller settings, the very risks is involved into it. How can one prevent themselves? I know we talk about masks, we talk about hygiene, we talk about, but even as we hold food into our hands, it's important that we understand that. And part of that is the duration of the activities we're doing, right? How long are we spending there? How long are we going to be among the crowd? How long are we going to spend our time? So it's important that you calculate all of that to say, well, I'm going to spend 3 hours over there. I'm going to spend 4 hours over there. And so the chances that you're going to be mingling with people, you're going to be interacting with people more frequently, what risk factors are there? You know, these are things to consider as we consider, because it brings people to exposure, right?
Mm-hmm.
The more you get yourself there, you get yourself more exposed to those things. Was there any other different topic you want to add on that?
No, it's just that like you were talking about public gathering, going out to crowded places. Like we all know, it couldn't just be COVID. It could be COVID, it could be flu, it could be something else. There are a lot of immune diseases right now in the air. People are sick a lot. So if you don't have to be to these crowded places, because sometimes people just go to places that they don't really want to be or they don't have to be to. So if you don't have to be to, if you don't need to be there, don't go. If you have to go, make sure you protect yourself. Have your sanitizer. If you have every opportunity to wash your hands, do that. If you're gonna be eating food, wash the food that you eat. Cover your food if need be, wash the kind of food that you eat, and just watch the people that are close to you just to stay safe.
That's right. That's right. And one of the things that sometimes maybe we don't remember now is that there are people that get the disease and it takes so long in them, right?
Yeah.
And so the American people refer to it as long COVID and ongoing health effects, right? So it combined to that. You have underlying health issues, then you get COVID, and then sometimes you find yourself like 1 month you are in there, you are coughing, you are maybe you're having consistent, persistent fever and all of those things, headaches, they it persistent and it can't finish. So it's important to understand that long COVID, which is referred to as persistent symptoms, they last for several weeks. Sometimes it goes for a month in some people, right?
Mm-hmm.
Especially after the acute infection take place in them. So what literally people it take effect and then it become difficult for it to be resolved or for it to be cured, and it affect significantly the uh people, especially who might maybe sometimes have survived it once, right? So because the virus being in you, and then when it come, it it kind of sometimes still try to wreak havoc in people. But as we talked earlier on about people trying to make sure that you take your boosters, it help to curtail the difficulty or those risk factor that it will have placed you in. It helps to do so. Um, was there any thought in terms of those lung symptoms that people face that are COVID related and so forth, and how people should treat them, how people should handle those lung symptoms?
Lung symptoms with those who have been infected with the COVID.
Mm,
If you're having lung symptoms, like we always say the first thing you want to do is see a PCP to see if there's anything that could be done about it. And if you're one of those person who have these lung symptoms that you're still in a position to affect others, you want to make sure that you don't keep quiet and just allow other people become infected. So it's okay to talk about it. It's okay to like let people know, and I don't think that should be something that people should judge you on. I think it should be like a non-judgmental zone for those kind of cases.
mm, non-judgmental also. All right. Well, folks, you have it there. About it, don't forget that COVID is still hitting around, and so don't forget, though it is no longer pandemic, but understand it's endemic, and so as though it doesn't make any big concern among people any longer the way we used to have it before, but yes, still it's important you understand that um, you need to take advantage of the available resources just for your knowledge, just for your own safety. Read about it still, try to still get more information about what is the latest that is coming out there. Now that especially scientists are not like the way in a big rush, the way they were in the rush when they came newly. Now they are taking their own time to be able to bring spend time in investing in the investigation aspect of it. As symptoms keep arising from one person to another, they are trying to ensure that they work with all of this so that they can continue to make provision for treatment or appropriate medication that they can or vaccine that they can come up with that will continue to prevent all of us and keep us safety and healthy. All right. And part of that also is that we must understand that people from every angle, everyone is responsible to keeping your community healthy. You are responsible in your own community, in your household. You are responsible to keep the community healthy or your home healthy so that your neighbors will not be affected. So that's why it's important that we should continue to talk about the issues that affect us as people in the communities that we live in. And that's why we should not stop talking about it. Those smaller things, they are very important. The COVID, this, very important for us to talk about them because they help us to remain healthy. They help us to remain safe. Um, I know people they saying that they usually say prevention is better than cure, right?
Mm-hmm.
Prevention is better than cure. So make sure you taking the necessary precautions to get in there. All right. Now let's talk about this new virus that maybe for many people, it will be the first time you might be hearing it. The Shigella virus, right?
Mm-hmm.
How about that? Can you tell the people more about that?
So, the Shigella virus, sorry, excuse me. I'm sorry. So, the Shigella virus affects the digestive system of a person. So, if a person has Shigella, the first thing it affects is the digestive system, which usually causes diarrhea. That's one of the very first symptoms of Shigella. So, if you start having diarrhea, that might be bloody because the diarrhea usually comes with bloody stool too.
All right. So Shigella, as the name is called, it looks like almost human being. All right. But Shigella is a bacterial infection that is spread through contaminated food, right? It's
Mm-hmm.
spread through contaminated food, it's spread through water, it's spread through direct contact with infected individual. Now that makes it very important for you to know about it because it's spread through what? Direct people who direct contact with people who are infected with it, right? And but look
Right.
at the ways it is a virus that uh it's a bacteria that spread through contaminated food, it spread through water, direct contact with individuals that are affected or infected. All right. Now, that is what
And,
you need to know primarily about this virus. That's the
and
first
just
thing you
like
need to know.
it's another question, just like last week we spoke on hepatitis A, and we said that it could be spread through feces. It's the same with Shakira, so it can be spread through they're tiny germs from feces. The moment which is your stool. So if you touch it and the person has Shakira, that stool and just maybe it touches the surface and you touch that, that's how it can be spread too. And maybe the person does not wash their hand and they try to prepare food, then it transfers to the food, people eat it and they get it. So the most tiniest germs or bacteria you can think about could cause the Shigella to spread very rapidly.
Mm. All right. And you initially started talking about the symptoms that you find to see that, oh, what, about this Shakira. So symptoms usually include diarrhea, right? That's the first thing uh,
Right.
that probably would tap up. But also fever and then stomach cramps, right?
Mm-hmm.
Stomach cramps, right? Then sometimes I think you mentioned about is it bloody stool?
Yeah, your diarrhea may become bloody too.
Yes. So these are the things, these are symptoms. When those things happen to you, you should, and that's why I don't even wait for it to get worse. Don't wait for it to get. So when you see those things, it's important that you right away try to reach out to your healthcare provider. Now, who is most at risk in terms of this virus Shakira infection? Who are those that are highly at risk?
People who are highly at risk are those maybe already have issues with underlying issues with their digestive system or the other organs within their body. People who have sexual partners that, let's just say, I'm trying to use the real word. Um People who have sexual partners or oral sex, those people are highly at risk too.
Good, but because, and I want to add a few other stuff, because the virus is spread through contaminated food, is spread through water, and is spread through direct contact with infected people. Because of that, so we likely want to say that people who are at risk will be first young children, right? Young children, because they take anything they eat, they put into their mouth, right? So any child under 12 years old, especially our 6, 7, 8, 9, we have to be careful with them, because at any time they put their fingers in their mouth, they don't wash their hand easily, and so forth. So we should be able to encourage our children to make sure they increase our hygiene, because they are the primary people that are at high risk, young children. All right. Next will be those travelers, right? Those that travel from one area to another, right? So you're traveling, you're holding things, you're grabbing this, you're in public place, you're grabbing that, airborne, and all of that. So travelers also stand to be at risk of this virus. And also people that practice poor hygiene, right? People that practice what? Poor hygiene, they also stand at risk of this virus, poor hygiene. So that's why we should increase our hygiene practices, okay? Making sure that you take bath, you wash your hand, right? Some people, they come from out and say, I'm too tired, let me just take bath tomorrow morning. You rather maybe take bath in the evening, and maybe you say in the morning, let me go, because you eat your all right. But it's important that you practice the best hygiene. Don't come from out and you just say, let me sleep tomorrow, I will take that. Make sure you do that. Practice pure hygiene, please. Regard. And the good news is that it's not as cold as it used to be then, right? So now that all of that is gone, it's going, it's fading away. And so that's why we should practice, because we're going to be sweating a lot. We're going to be perspiring a lot. And so little thing you do, you're going to feel the heat, right? So it's important that as the skin, as you're sweating, don't just go and go lay down on your bed, and then then the same bed you have not taken by, and so or suggest sitting anywhere on your chairs, and so just make sure that you will practice good hygiene, and helping our children to do so. When you take them to the park, you bring them, let them, the first thing you do is take them to either go straight into the shower to take bath, or they go and wash their hands, as a first steps, because they stand at risk for this this virus, or Shikila virus. Young children, those that are traveling, poor sanitation, all right? And then people close to the contact setting, wherever someone is infected with this virus, you are close in that vicinity. What happened is that this virus, and particularly talking about daycare centers, right? Daycare centers are at the higher rates of this virus. Daycare centers, because children playing, one child got snow all running on their nose and all that, and then they are not cleaning. The other one is crying. This one is doing it. So all of at the daycare center, children bring all sort of things. So that's why when you take your child, always get wipe with you. As you take them, before you even put them in the car, wipe them. and so forth, so that they can, because children stand as a primary at-risk people or persons for this virus. All right. That's very important for us to point out to us tonight. If you are listening to us, try to make sure you get your kids, if you especially those in daycares, young children, you take them to park, improve and increase sanitation and practice proper hygiene. Now, how does it take for, or how long does it take for symptoms to appear after infection for people affected with this virus? Do you, do you
1 to 2 days. Anywhere
one
between
to
one
two
to 2 days.
days?
Yeah.
Very clear. Now you heard that, folks. 1 to 2 days, then you see the symptoms happening. All right, diarrhea, fever, stomach cramps, right? You see those things happening around you. 1 to 2 days, right? Literally. How about can this virus or Shakila infection be severe? Can it be severe? How severe can it be?
It can be severe, it can get severe, and it comes with complication because, like we say, one of the main symptoms is diarrhea, which leads to dehydration, and we all know what happens when you become dehydrated. Another complication can also be seizure. It can cause rectal prolapse, also along with other issues too. Reactive arthritis or arthritis and all of that. So yes, it can be severe if left untreated and not
That is
taken
it.
care
Yeah,
of.
that is the most part we want to make sure we stress out to say. It becomes severe if you are not paying attention to it, right?
Yeah, yeah.
You're not paying, for example, you got running stomach, you're not paying attention to it. You got severe fever, you're not paying attention to it. So then it's gonna make it severe. It's gonna make it severe. So folks, as you hear us, as you listen to us, whether you're watching this later, understand that, yeah, that is another thing that we need to take care of, Shakira virus, which also affect the immune system, because once you are dehydrated, once your stomach is running the diarrhea, your immune system will become weak. They will become weak. All right, so take note of that. Now, in terms of measures, preventive measures that we can use, what comes to your mind, or what do you think? What are some of the key measures to prevent Shakira infection that we can advise our people tonight?
So we can prevent it by, and also by those who also have or already have it, prevent by spraying it too. The first thing is to wash your hand. You want to make sure you wash your hand very often, especially before eating or preparing food, after using the bathroom or changing diapers for mothers. You want to wash your hands after changing diapers. You also want to make sure you do not prepare food if you know that you are sick or share your food with anyone.
Mm,
So you also want to make sure that you do not swim. Like, don't go into public places where there are swimming pools and a lot of people are there, then you jump into the pool.
then
You
you
want to
affect
stay
the
away
whole
from that.
motor.
Yes. Do not have sex for at least 2 weeks if you know that you have Shagida.
That's why
Also,
you should prevent.
yeah, for at least 2 weeks after you no longer have diarrhea, because that's the symptom. So if you start getting treated and maybe the diarrhea cut, you can say, okay, the diarrhea is gone, so I'm okay. It has to be 2 weeks. So you also want to make sure that you stay home from school. Like what Pastor was just mentioning about daycares, that kids get these very quickly from daycares from the school. So you want to stay home from school, from healthcare area, from food services, childcare jobs while you're sick until your health practitioner clears you. You know that you are fully well and okay to be out.
Very good. Thank you for that. And now, talking about all of this, what role does sanitation play in terms of preventing Shakira outbreak? What role does uh, sanitation really play in this to curtail this virus spread?
It plays it plays a very important role. I think sanitation is like the first step because from where it comes from where the cigida originates to spread out to other people. If everybody's paying attention to the sanitation, you're washing your hands properly, you're not going to prepare food that are being contaminated. You're not going to touch surfaces that are being contaminated. You're not going to open drinks or touch drinks that are being contaminated. Your water's not going to be contaminated. You're not going to infect other people around you. So it plays a very, very, very major role. Washing your hands properly, like we said, wash your hands properly, clean around you, make sure that everything's clean. You change your kid's diaper, you want to wipe, maybe there's a leak of urine or maybe some of the poop wasted. You want to make sure that you clean after yourself, wipe it off, wash your hands and trash it properly, dispose of it properly.
Dispose of it properly. Now, okay, very important. Now, this question is really, really important, and I want to make sure our audience know about that. Are there any vaccine available for Shakira that you know of? Now, while she's coming up, are you there? While she's coming up, it's important to mention here that as far as it is that currently there are no vaccine yet for Shakira, uh, making preventive measures will help us to ensure that we don't get it contracted. So that's why we should take charge of hygiene, proper hygiene and sanitation, and to make sure that we don't eat contaminated food. So I was asking whether there are any vaccine available for this, Shakira.
Oh no, right now there's no vaccine. There's no vaccine for Shigida. That is why it's important to pay attention to keeping and protecting ourselves, staying safe and healthy, following the protocols like staying washing your hands, paying keen attention to sanitizing around us and everywhere we can possible. Because there's no vaccine, there's only treatment. We usually will be treated by antibiotics, but there's no vaccine right now for Shigida.
Well, friends, that's what you heard. And currently there are no vaccines for it. And so the question now will be what treatment are available for Shakira infection? Usually, you want to share with us because we don't want to leave our audience just like that, or what are some of the treatment that are available for Shakira?
So usually when you get diagnosed, your health practitioner is gonna usually it's antibiotics that are prescribed. There are specific antibiotics that are prescribed for this for Shigida, and I think it's based on the severity of your case too. So your PCP is gonna prescribe these antibiotics and give you your length of time that you're supposed to take them for. Usually antibiotics are taken for 5 days, and then after that they're gonna have to clear you and make sure that you clear before they can tell you, hey, you can go by your normal business. And also just home remedies to stay healthy when you have shakira. Maybe like drink a lot of water because you don't want to get dehydrated because of the diarrhea. You want to make sure that you get enough rest as you can and watch the food you eat safely and healthy.
That's right. So saying there are no treatment, you need to make sure you drink a lot of water, right? Because that's one thing. So you stay hydrated.
Mm-hmm.
Don't excuse me, you don't want to be dehydrated, right? So ensure that you drink a lot of water to make sure that you have, you got something to support your immune system. And it's important that you seek medical attention, regardless of what it is, especially when you don't know what your symptoms are leading to. So because you don't know, that's why you should even seek medical attention. Well, thank you so much tonight for being there with on this community health talk. We encourage your comments, your feedback, how much this program is impacting you. So we encourage you to give us the feedback. Give us the feedback as to how well this program is impacting you. Now, what are your comment or your parting comments tonight?
Well, it's been a good time on here. in as much as we will appreciate if it can become more interactive, but we know you are watching, we know that you are taking notes. The pastor just said, please leave your comments, like if there's any input that you have or any suggestions, we appreciate that. And it's been a good time here. We appreciate you. Thank you, Aleva, for giving us this platform and or allowing us to use your platform. And thank you, Pastor Daniel, thank you, PDPH, for sponsoring this program. And we say do have a good evening and stay safe.
Thank you. We want to thank you all for joining us, and we look forward to joining with you again next week, Monday. Thank you, and God bless.
Rising Hope for Change presents a community conversation on public health preparedness program hosted by Reverend Daniel H. Lindo. Open discussions and insights on heat warnings and other public health emergencies. Philadelphia Immunization Program, preparing your home for every season. Personal preparedness to stay healthy. Engaging faith-based and community organizations to consider planning for emergency. This and more is going down and will be discussed live on Island Vybe, Philly Caribbean Station, www.islandvybe.net, every Monday, 7 p.m. to 8 p.m.